What brought you out here today?
I don't think there's a topic that's more prevalent, not only in the state of Mississippi, in our country right now, than healthcare. And so summits like this one are a buzz right now, and they're blowing up all over the place. As you guys know, the Journal, you're seeing a lot of this activity, so it just confirms something that we've already kind of realized as a company. In 2014, depending on what happens with Obamacare, as we've been listening to and hearing about today with several of the speakers that were here, it's going to bring a lot of changes. And a lot of the laws and rules and regs and guidelines that we're reading, it's rocket science. I mean, it's a lot of information buried inside of a lot of information. But at the crux of it, there's harsh penalties that will be assessed for employers who do not provide a minimum amount of primary health care for their employees. And so advising them and getting the word out like these guys are getting the word out today, that the penalties will be there. It could be some stiff penalties for companies who do not provide. We fit that. We offer an alternative to, not completely to that, but it's a big piece of that. Almost 70% of healthcare is in the primary healthcare arena, is what we've seen, and we fall into that 70, especially when you include pharmacy and labs, which we include with our primary healthcare. It's all encompassing.
Well, Mississippi is far ahead of Michigan, for example, on the establishment of the exchanges. Michigan is one of those states that has not yet fully established the exchange. And so the battles that we're fighting further up north, you folks have dealt with months ago and are much better positioned for 2014. I think this is very valuable for HR. If I'm in an organization where HR is truly a strategic player, is at the senior leadership table, then I'm going to be able to offer some significant input into what our organization does. If I'm HR in the old transactional model of just making sure we stay out of legal trouble and make sure all our forms get off to everybody when they should, this is going to be a real challenge for me and for my organization. And so I really, if I'm in HR, I'm going to have to step up my game if I'm playing in that latter category.
You know, if you listen to Commissioner Cheney today, he made a very interesting presentation, and the essence of his presentation was, regardless of who wins the elections, and that will have some implications, but regardless of who wins the elections, there are a number of things that have been passed that are unlikely to change. And so in that context, I'm not sure that the election decision that we'll have in November will really make that much of a difference. So it really has to do more with the specific details going forth, and that's the reason why we have this conference.
While I have you, the vice presidential debates tomorrow, a lot of people have kind of written that off politically, but what do you want to see as far as the discussion tomorrow night, and especially regarding health care?
Now, if we can address, and I know it's difficult because it's an abstract topic, but if you can address the path of healthcare costs in our nation and how unsustainable they really are, then I think we can make a significant advance in terms of understanding the public policy debate. So I'd like to hear something about the sustainability of our current path in terms of healthcare costs.